Hi, I'm Dr. Palm from Art of Skin MD in San Diego, California, and I'm continuing on this patient, just doing a little bit of Restylane Silk, the most recently FDA-approved hyaluronic acid filler, just to help her with the lip line. So if we pan over to the patient, I've done a little bit with a little cannula point entry to treat this right portion of her upper part of the white lip, which helps smooth these over time by actually giving a little bit of volume to that. Now I'm going to treat what's called the vermilion border, which is that little white border that we see between the white lip and the pink part of the lip, and it plays a really important sort of structural role with the lip itself. So I'm going to do just a very small amount of the Restylane Silk right in that border. And I tell patients this is almost like a little bit of buttressing in this area. It's a really important sort of division between these two important cosmetic units of the skin or of the lip. And I barely have my finger on the plunger, just doing very, very small amounts as we go along. And you can see that starts to pop the lip up. You can start to see a little bit more of the Cupid's bow on this patient. I'm going to do one little guy along the center here. And when I get to the other side, we're also going to work on the inside of the Cupid's bow from that side. And you can see how that really starts to perk this up. The other thing that we'll do, and I'm going to have you open your mouth a little bit, is just deposit a little bit in what's called the subcutaneous plane, which is just right below sort of the surface of the skin. It's very low tension on the red part of the lip between this vermilion border and what we call the wet border, which is where you start to get that wet portion of your lip, just to help scooch a little bit of this filler itself into that plane. And it's just going to smooth the wrinkles of that area of the lip. One little poke. And this is a filler that you really don't want to do a ton of massage. It's not meant for a lot of lip filling, but it just sort of smooths things. So you may do a little bit of light touch, but not a lot of actual molding, just really for blending and making sure that it's pretty. And when the patient comes back in about a week to 10 days, she's going to notice there's much less density in terms of some of the little lines that actually run through the pink part of the lip. All right, so that's sort of part two. We'll work on the lower lip in a second. And this is Art of Skin MD, Dr. Palm in San Diego, California. You can give us a call at 858-792-7546.